obviously a smile is more than the cosmetic part of it.
Yeah.
What in the article in the Ultimate Beauty Guide you wrote about dental implants and the important function of those. What sort of are the typical patients that you're seeing in your practice?
Well, most of the patients are 55 plus, and they want something that they feel is going to make them look more attractive and more confident. And with the men, they're normally like driven by aesthetic needs. So if someone in their family's told them, you know what, that tooth missing really doesn't look too nice, can you please go get something done about it? And then the female patients have normally been putting up with the gap for a long time, and they really would just want to do something about it.
So the men, men always seem to need a nudge to get anything done.
Yeah, the men need a kick, to get there. But when they're there, they're committed. They really want to get it done.
Great. And is it a complicated procedure?
It's a fairly simple procedure because implants have been around for a long time now, so we really have a lot of evidence. We know what we're doing. It's not very painful, and it's a fairly quick procedure, and it's really common these days.
Okay. Well, I've got two questions. One is from Lauren from Cardiff, and she said she's frightened by the look of the implant.
Okay.
And does it hurt really?
Well, the implant maybe doesn't look very pretty when you look at it when it's out of the packet, but it doesn't hurt. It's a local anaesthetic procedure. Takes 20 minutes, and it's very quick and simple.
Because it does look quite scary because it's getting screwed in. It's like getting the screwdriver out. And
it can look really scary, but what really surprised me, some patients sometimes say, can I see it before it goes in? And you're like, okay, I'll show it to you. But it can look very daunting, and the whole thing is a daunting idea. But once patients have had it done, they're normally like, I can't believe it was so painless and so quick.
Well, I've got one more question. It's from John Morgan from Newcastle, and he tweeted, I know it's an expensive treatment. Do companies offer payment plans?
Yeah, this is something that a lot of patients are scared about, is the cost of the treatment. But we can normally break it down over 2 or 3 years and break it in really small bite-sized chunks and make it really affordable for everyone.